ECTOR, and today we would like to share some updated information with our community. First, focusing upon the medical condition, the COVID-19 situation in our community. We've asked the team from MCH to join us today, and we'll follow up with some very specific COVID-19 information from ECISD, as well as just some opening of school information. But we'd like to start today with a health update on what's happening in our community. So I'll invite Russell Tippin to join us. Russell.
Good afternoon, everybody. I guess it's nice to see all y'all again. My name is Russell Tippin. I'm the president and CEO of Medical Center Health System. I have with me here today Kristen Timmons. She is our chief nursing officer at Medical Center. So we have some update just on our current situation at Medical Center, just to talk about masking and about hand washing and about COVID-19 vaccines. But first of all, I'm just going to run through some numbers, and then I'm going to turn it over to Kristen, let her talk about some nursing stuff and some back-to-school safety stuff, and just to be ready to be safe as we battle COVID in our community. We'll tell you that y'all know, and we all know, that COVID is alive and well. The battle is not over. In fact, it has escalated quite greatly in the last couple of weeks. If you remember, just a few weeks ago, we were down in the 1s and 2s, and now today in the hospital, we have 49 COVID patients in the hospital today, which is a pretty good increase. Overall, the hospital is pretty full. We have 243 in the hospital. 49 of those are COVID. 28 of those are critical patients, which means they are in our critical care unit. Out of those 28, 23 are on the ventilator. And one interesting fact, all the ventilator patients are unvaccinated. And so that is some pretty powerful information, that out of this 28 that are critical, 23 of those are on the ventilator. They're all unvaccinated. So that's pretty powerful. On our non-central unit, it's full. We created that a few days ago to help with our need of bed space and ventilator space, and it's full. We have 21 on there, 21 COVID patients on that floor right now. I will tell you, total, out of our 49 patients, 41 of those are unvaccinated. 7 of them are vaccinated. So you can do the math there on what the vaccine does. We have a lot of questions about vaccine. We get them all the time. We want people to make a good choice and an informed choice and choose for yourself what you want to do. But when you start looking at the numbers between critical and non-critical and vaccinated and unvaccinated, it's very clear that the vaccination gives you a better chance to fight this off. And that's what it's about. I will tell you one area of concern that Chris and I have spoken about earlier today is that Medical Center only has 10 ventilators left, and we are reaching capacity on our ventilator status, which is very, very scary for us. We are doing our best to locate more ventilators. We're doing our best to find those, whether we use the disposable ones or we rent those, or where do we get those from. But I can tell you, everybody everywhere is looking for a ventilator. Every hospital, every facility, nursing home, everybody's looking for ventilators, and they are very hard to come by right now. And so we're doing our best to get those, but they're not cheap, they're not easy to come by, and they're in high demand right now. So our message today is, again, nothing has changed as far as our message has been concerned, is to be safe, make a good choice, wash your hands, educate yourself on the vaccine, educate yourself on what the vaccine does. These numbers will tell you the vaccine gives you a better chance of survival with this COVID-19, this Delta variant. It gives you a chance to fight it off. There is no doubt. We look at our patient load today and the status of our patients. You can tell just by looking at them who's vaccinated, who's unvaccinated, by the way that they're tolerating this disease. So please make an informed decision, and please be safe with that. And with that, I will turn it over to Kristen to talk about nursing stuff, what nurses talk about, and she'll tell you a little bit about our employee situation, how many employees we have out with COVID, and just some safety tips. So, Kristen, I'll turn it back over to you.
Thank you. Good afternoon. So yes, we have currently 16 of our employees are out with COVID. We have 2 that are out on what we call cohabitation, where someone else in their family has it, and we have asked them to quarantine as well. We are in a crisis staffing situation, so we're pulling from different areas. We're offering incentives. We've requested contract staffing. So we are really working through that and how to properly staff and safely staff all of the patient care. So we'll be continuing to work through those things and monitor the staff that actually are out or working. 11 of those employees that are out have been vaccinated, so we're monitoring those things as well. Overall safety within the hospital, we're just really looking at what we need to do to continue making everyone safe. And Russell alluded to the vaccines and the importance of. So just a reminder to everyone, we do have vaccines and we have plenty of them. We have them at our JBS location as well as our West location. And so we want to make sure that we provide the opportunity for anyone that wants a vaccine to be able to get that. Free of charge, takes you about 20 minutes by the time you get in, get your vaccine and recover. So really no wait time at all. We'll do our best to get you in and out quickly. As we return our kiddos to school, we just want to make sure we send a reminder out. If they can keep a mask on, we'd like to encourage them to wear a mask. Although we know many are not mandating it, is still a very good barrier to keep in mind. So I'd encourage parents to look at the mask and work with their children on keeping it on. Hand sanitizers, washing your hands frequently, distancing from other people. And I even tell people with school supplies, wipe those bags down every day after school. Make sure that they're all clean and ready to go before you bring them in your home. And then you send them back out to school the next day. Those little things we don't think about, all the kiddos share those. Our lunch boxes, we just want to make sure that everything is truly clean to try to rid any of those infections from coming into your home or going back into the schools. So I think that's all I have.
We just want to thank Dr. Muri for giving us some time today. We want to wish all the teachers and the mamas and the daddies and the students a great year. We know there's a bunch of them out there, but again, as Kristen said, we're here today to make sure everybody understands. You have to protect yourself. You have to be safe. You have to be proactive, and you got to do what's necessary to protect you and your family. Hand hygiene seems very simple, but it has proven as well to be a good, effective way to slow this down, because hands goes in mouths, hands goes in noses and eyes, and that's how quickly things happen. And as Kristen said, wipe things down. Very simple things mamas and daddies can do as school gets ready to start back up. But we want to thank ECISD for being a great partner with us. We will look forward to having vaccines and tests readily available. Should any student, teacher, staff member, superintendent, anybody should need one. But at the same time, we are just very grateful for our partnership with the school district, and we want to wish everybody a great school year and be safe. And with that, I'll turn it back over to Dr. Muri.
Thank you, Russell and Kristen. And this superintendent has been vaccinated, so I'm ready to go. But a booster may be in the future, so we'll keep an eye for that. And I appreciate Russell and Kristen being here today to share this important information with us. The safety of our students and staff members is a top priority for ECISD, and the vaccine is available for students 12 and over, and we're strongly encouraging those families that have not had their children vaccinated yet to take advantage of that opportunity. In fact, right now, the ORMC bus, their mobile van is sitting at Murray Fly Elementary until 7 o'clock tonight, providing vaccines for any of our students 12 and over, or any adult in the community that is interested. On Monday, that same van will be at Nimitz Middle School from 8:30 in the morning to 12 o'clock in the afternoon, again providing vaccines for our students that are 12 years of age and over, as well as any adults that are interested. We'll continue to partner with both hospitals as well as our health department to provide vaccines for students. Masks, per the governor's order, we are not requiring masks in ECISD for students or staff. However, we are strongly recommending that all of our students and staff members wear masks at all time when we are indoors. That is the CDC recommendation. That is the recommendation of our local and state health authorities, and that is the recommendation that we're giving to our community as well. Again, not requiring, but strongly recommending all students and staff members when we are inside to wear masks. In-person attendance is required for all students this year. Virtual is not an option, so all students are required to attend school, and that will be in person this year. And because of that, we will continue many of the safety protocols that we had in place last year in ECISD. We are asking all students and staff members every single day to screen for COVID-19 protocols. There is a form that is located on the ECISD website that outlines those COVID-19 conditions, those indicators that one might have that would indicate that they potentially have COVID-19. If any of our students or staff members have any of those conditions in the morning, we are asking them to remain at home and then seek out a COVID-19 test to find out if indeed they have the virus or not. Hand sanitizer will be available in all of our buildings as schools and staff members are entering facilities. Hand sanitizer not only will be available as you enter, but also throughout the buildings. We'll again provide that this year. Routine cleaning and disinfecting will continue. Our custodial staff and maintenance crew elevated their procedures last year, and we will maintain all of those those cleaning procedures this year in all of our campuses. We'll remind all of our students to use appropriate etiquette when needing to sneeze or cough. Keep your distance from folks. Use your elbow to take advantage of those opportunities. And then we'll remind our students of proper mask wearing guidance. Thank you, Russell and Kristen, for talking about that today. Wearing a mask is one thing, but wearing it appropriately is important as well. We'll help students with that, encourage our parents to do the same. Masks and shields will be available on all of our campuses for any student or staff member that does not have one available. Once again, those will be available on every campus and facility in ECISD this year. Our teachers will keep seating charts again this year, allowing us to contact trace should any of our students or staff members be found to have COVID-19. Our nurses will engage in the contact tracing process, and those seating charts that teachers keep will help us identify any students or staff members that were close or in close proximity to any individuals that have COVID-19. Our cafeterias will be open this year for lunch service. We will use appropriate social distancing rules when feasible in our cafeterias. Our students will sit together by class, so we won't have the typical movement that one might see in a busy cafeteria. We're adding additional sneeze guards to all of the food areas to help avoid any contamination of food substances. And our cafeteria staff as well as maintenance staff will add enhanced cleaning to all cafeteria facilities this year between the times that children are eating. Odessa High School and Permian High School will be allowed. They're juniors and seniors. Those that fall within the criteria will have off-campus lunch privileges this year. That will allow us to, during the lunch periods, keep a number of students out of the cafeteria on those two campuses. And again, that's Permian and Odessa. Those juniors and seniors that qualify for off-campus lunch privileges will have those this year. Water bottles will be provided to all of our students every morning. We'll be, once again, feeding all students breakfast and lunch free of charge this year. So that is every single student has a free breakfast and lunch. And in the breakfast packet every morning, a bottle of water will be located in that. So every student every day will have access to a bottle of water that they can carry around with them. Water fountains will be closed continuing this year. They were closed last year to avoid contamination. We will continue to keep those closed. However, water filling stations will be open. And so students can keep that water bottle. When it is empty, they can use that bottle at a filling station around campus to get more water, or bring water bottles of their own if that's something that our kids choose to do. Our transportation department will continue to follow the guidance from the public health guidance that is issued specifically for public transportation and school buses. Our buses will have normal occupancy this year. They will keep the windows down to keep airflow throughout the bus to keep kids safe. And so that will be required. All students, when they enter the bus, hand sanitizer will be available for those students. And so they will use that hand sanitizer daily when they enter the bus. And buses will be sanitized twice a day. And so before students get on in the morning and then before students return in the afternoon, those buses will be sanitized. All of our athletics and fine arts programming will follow TEA and UIL guidance in relation to all UIL activities. And so as the UIL and the Texas Education Agency release guidance, we will make sure that all of our athletic programs and fine arts follow that guidance that is released. Testing and reporting. So ECISD staff must report COVID-19 tests to their supervisor. It must happen on a daily basis. So any staff member that does contract COVID-19, that must be reported to the supervisor. And then that staff member is quarantined. Same thing with students. Students must report positive COVID-19 tests, their parents, to the school. Those students are quarantined for a period of time. We do provide COVID-19 testing in our schools should one of our students or staff members during the school day display any of the COVID-19 symptoms. Our staff members have an opportunity to receive a quick test that can identify if they are COVID positive. Students have that same opportunity. Every nurse in our schools has access to testing facilities, and students have access to that. That is with parent permission. So a parent must give permission in order for a student to receive the COVID-19 test. But again, those are available in each of our schools throughout the day should any students or staff members display symptoms of COVID-19. We will continue to report cases of COVID-19. So should a staff member or student contract COVID-19 and we have that positive test result, we will continue to report that to parents of the affected school, as well as on our dashboard. We maintain a public dashboard that lists the COVID-19 positive cases every day for students and staff members by school, and we will continue to report that on a daily basis. And then all of this information will be available, or it actually is currently available on the ECISD website. We remind everyone to pay close attention to the ECISD website as information is updated daily. In fact, yesterday at 3 o'clock, a plethora of new information was released to schools across the state, and we are still working through some of that information, and we'll make that available on the ECISD website. But just as last year, information changes on a regular basis, so we encourage all of our parents to make sure they pay close attention to our website. A few other non-COVID related opening of school questions. Registration, if you have not yet registered your child for school, you may do that online or simply visit any school in ECISD. It doesn't have to be the school that your child attends. You can visit any school in ECISD to register your child for school. And school begins next week, but I would make sure that all parents are well aware. We have 2 start dates next week for school. And so on August 10th, school starts for pre-K through 6th grade students, as well as 9th grade students. And then on August 12th, school will begin for 7th graders, 8th graders, and then 10th through 12th graders. And so if you have a middle school or high school student, parents need to pay close attention to the start date of your child. All elementary students and pre-K kids begin on August 10th, but middle school and high school, it depends on the grade level as to which day you begin next week. And so it's important to pay attention to that. Several of our school start times and end times have also changed. And so moms and dads, if you have not already looked, you need to visit the ECISD website, specifically the website of your school, to find out the start time and end time for your school, as several of them have changed from last year to this year, and that's important information. We are now educating 3-year-olds, and so for the very first time, ECISD will welcome a host of 3-year-old students in partnership with the YMCA. So moms and dads of 3-year-old children, if you are interested in that 3-year-old pre-K opportunity, again, any of our schools can register for you for pre-K, as well as the YMCA itself. You're welcome to visit that site to register your child for pre-K. And that big reminder, meals are free again this year for all students, breakfast, lunch every day for every student in ECISD. So that's it for me. We have lots of time for questions. I would be happy to answer any questions, as well as Russell and Kristen, any health questions as well. We'll be open for that. Yep.
Will there be increased nurse personnel at the at the schools?
I don't think so. We have not increased our nursing staff this year, but we do have nurses available for all of our students, elementary, middle, and high school.
Okay, and is there a plan in place for like a large outbreak or something, like some kind of emergency?
For large, we anticipate, because of the high numbers of COVID-19, that we could see large numbers of cases of COVID-19. So we're ready for that as a school system, and I know our hospitals are ready, but none of us want to get to that place. There is no room in their inn, and we certainly need our kids to be in school every day. So we've taken every precaution necessary to keep our kids as safe as we possibly can. Our processes and systems worked well last year to keep our children safe. In fact, school was the safest place last year for children to be. But yes, should there be a significant outbreak, we're ready to handle that in partnership with our medical community.
Thank you.
So you said that there's a plan in place and everything, so you're ready to go. But is there any instance or circumstance where, we could go from in-person learning to back to online, or is that kind of, we'll play it by ear?
Sure, and we will. Right now, we're actually not able to do that. The governor and the Texas legislature would have to create a situation in which we would have permission to do that. But as of today, we're in school every day. Unless we get to an emergency situation, perhaps we don't have enough staff members to safely operate school. We hope we would never get in that situation, but, and again, all of the safety procedures we have in place are there to assure that that is not our future reality. Our goal is to have every kid in school every day.
I know this is a bad question, especially to ask at a news conference, but is there any thought of maybe saying, okay, this is really bad, masks are required, vaccines are required, we're just not wanting to take any chances?
We locally, I don't have the authority to do that. I think we are strongly recommending that our children and staff members wear a mask every day. We know last year that kept us safe, along with the other procedures that we have in place. I feel confident that most of our students and probably most, if not all, of our staff members will help and support that. The vaccine, it's a personal decision. I personally have been vaccinated, and I would certainly recommend that for anyone. But at the end of the day, everyone has the ability to make their own decision, and different individuals have different circumstances that may that may prevent them from being vaccinated for whatever reason. But I would certainly encourage that. And listening to what Russell just said. There are 18, I believe, people on a respirator in our own hospital, and none of those people were vaccinated. And certainly that is one element, one data point that I would personally consider should I be weighing to get a vaccine or not. And our elementary children right now do not have that opportunity. And I know the medical community is working on that, and hopefully at some point this winter, maybe late or early spring, that will be available for our youngest children. So.
Dr. Murray, you said that the the windows will be open. What about during the winter time?
Yeah.
You're going to do a combination of heat and...
Heat and really cold. The opportunity, even when it is cold outside, we can still vent, and we did that last year. We still kept windows partially open and with the heat on to make sure that air was flowing. The hope, however, is that when the cold weather does arrive in the city of Odessa, that the virus is long gone. That is our opportunity.
Are the school district staff, are they required to be vaccinated at this time?
We're not. No, staff members are, and really no one is required to be vaccinated. We're, again, strongly encouraging that, but no one is required.
What's the plan for children who test positive or who are exposed and then they have to stay home for 2 weeks since there's no virtual learning now? How are they supposed to access their schoolwork? How's that going?
Great question. So right now, from a quarantining perspective, let's do this in two parts. I'm going to ask Alicia Severson to come up. Alicia leads our nurses, and let her talk about the quarantining process, and then I'll jump back in and talk about the academic side. Alicia?
Yeah, absolutely. So on the quarantining side, if a student does test positive, of course, they'll be required to go home for the days that are required. If a student is exposed to someone who tests positive, we will contact the parent if we see that the exposure happened at school, and of course ask them to come pick up their child if possible. If the student is vaccinated, of course they don't have to quarantine according to the CDC guidelines. So that's how we'll process our students who are either positive or exposed at school, and we'll identify those exposures through contact tracing.
Is it then up to the parent, if they're exposed, to decide whether they want the child to quarantine or not?
If the child is exposed, parents do have that option in terms of whether they continue to send their child at school or if they will remain home.
I have a question on that. So what you're saying is that if a student has COVID-19, the parents have the option to continue to send them to school?
No, if a student is diagnosed lab confirmed with COVID-19, they do have to quarantine for the recommended time before returning back to school.
Oh, okay.
Let me hit the academic side of your question. And so when a child does test positive for COVID-19 and they are quarantined, literally this happened yesterday afternoon, the state has given us some guidance that will allow for that child to continue to engage in the school process. We're right now working on what the details of that will look like, but the good news there is if a child tests positive for COVID-19 and is quarantined, they will have a chance to virtually attend school and engage in the learning process. So they'll be counted present as long as they are fully engaged. And again, more information about that will be forthcoming.
Does that mean you'll be able to be funded?
Yes. So that is the good news. And again, it's a very limited opportunity that we have. So the child would have to be COVID positive. They are at home and they would be required to engage a minimum of 4 hours every day in the learning process, and that will be done virtually. More information about that is forthcoming. Literally, this happened yesterday afternoon. We were notified, and we're right now putting the plans of that together as far as what that would look like. But so that's really good news, and yes, we would be funded for that, not only in Ector County, but across the state of Texas. Yes. Other questions?
Yes.
Oh, absolutely, yeah.
Is there, what information do you have on vaccine for kids under 12?
Yeah, let me,
Update on that?
and I'm not the expert on that, but I will let Kristen talk about it. One thing before she does, we just got update number, 931 cases currently in Ector County. That's an increase over this week, pretty substantial increase. So you have 931 positives that we know of in Ector County. Secondly, on our website too, just like Dr. Muri said, in the medical center website, we have a bar up there. It says COVID-19 update information. If you'll click on that, it's updated at 10 o'clock every morning with the most current numbers of patients in the hospital, vaccinated, unvaccinated, all that information's on there. It's updated every day. I'll let Kristen talk about the vaccine.
Would you mind repeating your question for me?
Yes, ma'am. If you could give me a second, please. Could you bring it out? Thank you so much. Russ, a little bit more, please, if you don't mind. Okay, I just wanted to know if there's an update on vaccination for kids under 12.
There has not been. They're still conducting studies, and so we're just giving it to those people that are 13 and over. There hasn't been anything released from the Academy of Pediatrics, to my knowledge, as of this morning.
But it is in process.
They are looking at it, yes.
That's it. Thank you.
How many nurses do you have and how many open positions are there?
So we have 73 open positions currently within our organization, and that's actually just positions that have not got people that are through orientation. So we have about 37 coming on board, so that number will be decreasing. But as of now, without them actually fulfilling a schedule, I'm going to tell you that we have a little over 70.
And how many FEMA nurses and traveling nurses did you have before in the pandemic earlier?
So earlier in the pandemic, when FEMA helped us, we had over 100. Right now, we're about 30 as far as our contract staffing goes that are here extra, and then we've made a request for about 30 more. I noticed yesterday that there's about 25,000 agency positions posted currently. So all of us are fighting the same battle. There's wage wars going on out there to try to see where they're going to go, as we see that contract staff are going to who's paying the highest. And so that's what puts those of us in healthcare administration a little bit in a difficult place, because we only have so much money to work with. And so we're really trying to funnel through those to see what the right choices are, in an effort to try to get some of those staff here locally.
Let me give you an idea what Kristen, on the wage side, last year, agency nurse would probably cost you $80, $90 an hour. The most recent, as of yesterday, was $160 an hour to get an agency nurse here. And we are aware that it is basically an auction, that they're going to the highest bidder. And as Kristen said, 25,000 requests in right now with no female nurses available, and it is makes it very difficult to get that kind of staffing here when you need it. Did you say that's
So
that?
are you having to turn away any COVID patients or try to find another hospital?
Yeah, we are currently not turning anybody away. I will tell you that we are on diversion status region-wide, meaning that we can only handle what's here in Ector County. We service 17 counties all around us that usually send patients into us. Right now, those patients are going to have to find somewhere else to be served, because we're handling our own patients. Usually, our COVID census has several people from out of county. Today, there's only one from out of county, so everybody in there is from Ector County. So we're not having to turn them away from here. If they're in another hospital and they're trying to get to a higher level of care, we are on diversion just like everybody else is. And when I say that, I read a story out of Houston today where they had to air flight a 4-year-old 150 miles away out of Houston. We usually try to send people to Houston. Houston's sending people out. So that kind of tells you exactly what the status is all over the world right now. It's just really, really packed all over.
So what's the frustration level, or what are you having to deal with statewide with the governor and wanting to do, really needing a mask mandate?
Yeah, I mean, I think our biggest frustration right now is, and maybe frustration is not even the right word. What we're concerned about the most is, of course, the patient's families. Everybody's stressed out. Then you add sickness on top of that. When you look at the age range of the people in our hospital that are COVID positive, 15 to 83. And we used to see that our biggest group were the 60, 70, and 80-year-olds. Now we're seeing our largest group is the 25, 30, 35-year-olds. And so you have these younger folks in there that were healthy 3 days ago and now are, very sick with COVID, and so it's stressing the families out. Our biggest concern and frustration we have is our staff is really going through what I'd call a post-traumatic stress, that they've been through this before. We got through it. We thought it was behind us like we all did, and now here we are facing it again, and we are really seeing a lot of our staff suffering with just the mental part of watching these healthy people come in and suffering, and unfortunately some of those expiring. We're really concerned about just the mental wellness of our staff, our doctors, our kitchen workers, whoever that may be, because man, they're fighting this every day. They're seeing it all day long, every day, and it's really taking a toll. And if you don't mind, I'd like just to ask this community, pray for those folks, because they are in this battle on the front line every day, and it is wearing those folks out, and we need every help we can get on that level.
Would the alert of COVID go higher if you started seeing 15-year-olds, 14-year-olds?
I think definitely. I think right now, we call it condition red or condition orange. The worst condition we have on the color scale is condition black. We're not far from there, and if all of a sudden this takes a shift again, we will definitely move into that. But I can tell you that that's why the parents have to be vigilant, and they're protecting their kids. That's why you got to really do your research about this vaccine. Wear your mask, wash your hands. We're right back in it again, just like we were, in January and February. And so we really want these parents to do what they can. And I know Dr. Murray and his team have done an outstanding job of getting things ready to see these 30,000 plus kids come back into school, and just to get ready for that. And we applaud them, and we look forward to working side by side with them.
You said earlier that the hospital is almost full. What does full look like? What's the maximum capacity and how many beds do you have left open?
Yeah. You know, people like me that sit up and count the numbers all day, we like full. We like to have all those people in our beds, but I can tell you that when we say full, what I mean is when you start talking about capacity as far as staffing, we talk about things like ventilators, you talk about ER wait times, that gets real busy in a hurry. And I'll let Kristen talk about the specific number of beds and what we would consider to be full bed count.
So really, when we start approaching that 300 number, it really kind of squeezes us just simply because we really don't have the staff. We don't staff to that capacity because typically your hospital isn't in that. So when we say full, we really are talking about what we have the staff to cover and safely cover our patients, the admissions that are coming in, those types of things, as well as the procedures that are taking place. If we said, oh, well, every bed is full in our hospital, and we're at max capacity, then we're certified for 402 beds. And that would mean that every procedure bed is full, every delivery bed is full. And so when we say full at 402 of our licensing, that's really not the same as us saying we're really at our capacity because we've only staffed to so much and we can only staff to so much.
So when you think about 243 today, I know that our conversations and text messages get a little more urgent. We start getting close to 255, 260, 270, which we've been there recently. And that really is just based on our staffing level. So, all right, anything else? All right, Dr. Murray, I'll hand it back to you.
Yes, sir.
Dr. Murray, so with, COVID cases rising, here in Ector County, if a parent is positive and sends their child to school, how are things looking from that perspective? Like, will the parent need to report to the school if they're positive, or what does that look like?
So if the student is positive, first of all, if the student is displaying any symptoms at all, we're asking the parent to keep that child at home. And that is the same thing for staff members as well. Any of us, if I wake up in the morning and I'm not feeling well, I'm staying home and then reporting that as appropriate. And we ask every parent to do the same thing. Please do not send any of your children to school if they are displaying any of the COVID-19 symptoms. If a child tests positive and the parent is aware that the child is positive, then that needs to be reported to us, and then that child needs to be quarantined for a period of 10 days.
So what if a parent is COVID positive and they send their kid to school? Do the parents need to report that as well?
No, the only thing that is reported to us would be if a child has tested positive. That's the information that we need.
Are there any consequences if a child tests positive and the student sends the child to school anyways? Is anything going to happen?
Well, I mean, we certainly hope that that doesn't happen. That this virus is, and I'll let the medical expert speak to that. But the virus is easily transmitted, and so we would certainly not expect anyone knowingly to enter any school campus knowing that they are positive, whether that's child or adult. And so certainly,
I'm just thinking, of course. I mean, if a child tests positive, the parent has to stay home from work to take care of the child. If the parent has to go to work to pay the bills, it puts them in a bind. I could see that happening where maybe they would send the child to school anyways.
that could happen. Again, our hope is that that certainly doesn't happen. We would have no way of knowing unless we test a child or an adult ourselves and see the actual results. So we certainly have to have the kind of relationship with our families that they are honest with us and sharing that information. We didn't have that experience last year. That is not something that we're accustomed to. Typically our parents want what's best for their children, and if their child is sick, they're going to do the right thing and keep their child at home. If a parent in that situation, you have a child that has tested positive and work becomes a challenge. We have services. Our schools have access to social services and other resources that could certainly help a parent in a situation like that. So, I would ask for a phone call. Our counselors and social workers have access to significant resources that could support a family in that situation. Anybody else questions for either one of us? All right. Thank you all very much for coming today. We appreciate it.